A third of hospitals nationwide violated a federal law that requires anyone who comes into an emergency room to be treated and stabilized, and that is according to an investigation led by WebMD and Georgia Health News. 11 Alive's Elwin Lopez tells us what they found and which Metro Atlanta hospitals are highlighted in this investigation.
When we looked at the number of violations, Georgia had the 6th highest number.
The investigation uncovered 218 EMTALA violations in our state between 2008 and 2018.
Instances where hospitals have violated a federal law called the Emergency Medical Treatment and Labor Act. That law guarantees care to anyone who comes into an emergency room seeking help. And it guarantees at least a certain level of care until you can be determined that you're not in a life-threatening situation.
An 8-month investigation that Goodman says highlighted a broken link.
We would like to see hospitals pay closer attention to the law, I think. You know, we saw too many cases of patients that should never have been treated the way they were treated in an emergency room.
Georgia Health News editor Andy Miller says Teresa Kung, a Gwinnett County teacher and nurse, is a prime example.
In Piedmont Newton Hospital, one doctor evaluated her and said, we need to do surgery right away. The second doctor said, no, we need to transfer you. That transfer occurred, but she got sicker and she eventually died that Monday.
This WebMD map shows the hospitals with EMTALA violations during that 10-year period. Northside Hospital 1, Piedmont Hospital 3, Grady Memorial Hospital 6, and the list goes on. So what can you do to make sure you and your family are in good hands?
The Center for Medicare and Medicaid Services has a hospital compare website where you can go on and see how they do on various quality measures. There's also the Leapfrog group that does its hospital ratings.
Goodman told me that the American College of Emergency Physicians calls EMTALA an unfunded mandate, that doctors are asked to provide care, but then there's no compensation for that care, leaving hospitals with a hole in their budget. We reached out to several local hospitals mentioned in this investigation, but did not receive a response by our deadline. Jeff?
Elwin, thank you.